See, we heard this fantastic overview from Rakesh about the work that we are doing at REAN. Any additional thoughts from your perspective about especially our focus on home-based care delivery and self-care?
Yeah, I think I just want to summarize everything that was told until this point, mostly. So really the vision of what we are trying to do is around 6 pillars. 3 of them are health related, 3 of them are wellness related. So for any health condition, it is important to make sure that patients are taking their medicines and medicines are available, like Rakesh just said. That's medication management. Vital management. So if you're a heart failure patient, you need to check your weight. If you're a COVID patient, you need to check your blood oxygen levels. Those are vitals. Then there's symptom management. So I may have chest pain or nausea or shortness of breath, right? So those are symptoms. So these 3, medication, vital, and symptoms, are any health condition oriented vitals that need to be, or pillars that need to be managed. And the remaining 3 are both very important for people with health conditions as well as just regular wellness. And they are, one is food or nutrition management. Second is exercise and activity management, like walking, running, etc. And then the last one is stress management, right? So what we are trying to do, and these have been known to be the key pillars in public health, preventative health, behavioral health for a long time. And they're not easy to solve. So for example, as a congestive heart failure patient, you are supposed to monitor your weight every day to detect for fluid accumulation. If you don't do that and we end up getting hospitalized, for example, even in advanced countries like the US, that is a $40 billion a year problem, right? But more importantly, there's a 1/3 chance of a person dying when they get admitted into hospital for that procedure because of the infections they catch and so on, right? So while it is easy to ask someone to check weight, it's very difficult to do on a daily basis. It's almost like asking someone to just wear a mask to protect yourself from COVID every time is easy to say, it's very difficult to do. So what we are trying to do is, how can we make it part of lifestyle? So hopefully a patient, if they sleep on their bed and get off the bed, their weight is taken. So they're not bothered by taking that weight. Someone else is constantly monitoring, right? So those are the kinds of solutions that we want to bring to the table. And like what Rakesh just discussed, his 11-year-old journey about bringing that, making medicines affordable, we want to try to make it accessible now on WhatsApp in any language that people can request, or just taking a picture of the prescription, right? So we can figure out a generic medicine. So that innovation to make it very accessible, very easy to use, is really what our focus is going to be.